I often see patients with cervical cancer usually by the time they're more advanced in their cancer diagnosis. So usually we're dealing with a much more complex situation at that time. And my role as a naturopathic physician supporting oncologic treatment is to do just that, support them as they're undergoing active treatment and make sure that they're having all of their macronutrient and micronutrient needs met, and to identify if there are certain therapies that we can use to augment whatever approach is going to be part of their standard of care. So if it's advanced cervical cancer, usually women are looking at some surgery as well as chemo with or without radiation therapy, or sometimes radiation with or without chemotherapy. And these can be really frightening therapies for a lot of women. And so my role is really to help support them during that time and make sure that they tolerate the treatment well, and also that we're doing as much as we can to minimize the collateral damage to the healthy systems and healthy cells of the body, and to reduce the risk of recurrence. So once you undergo those treatments, you may be disease-free, but of course, the question mark for everybody who has cancer but achieves a remission is this cancer going to come back, and when is it going to come back, and is there anything that I can do to help prevent it? That's called secondary prevention. So when I see a patient who comes to me with a cancer diagnosis and I know that they're going to be undergoing active treatment, I'm not just looking at from a nearsighted perspective what we need to do now. I'm looking at the long game. What do we need to do to preserve your health as much as possible and make sure that, like I said earlier, that we minimize that collateral damage and prevent your risk of relapse. There's opportunity there for us as naturopathic doctors, particularly those of us naturopathic physicians that have a focus in oncology like myself. There's a lot of opportunity for us to really focus in on what specific strategies we can utilize to prevent this from turning into a cervical cancer later on. Once it becomes that sort of advanced stage, diagnosis, then we're dealing with a much more complex situation. There's a lot more that needs to be done and needs to be looked at. But early on, it can be quite simple. It can be as simple as looking at the nutrition. It can be as simple as augmenting your immune system to make sure that HPV infection is under control. If you're immune compromised, that infection is going to linger a lot longer. Whereas if your immune system is healthy, then that HPV infection can come and go. It can be active and then dormant. And the longer it's active, that active infection interval actually is what increases significantly the risk of this turning into a cervical cancer. So the earlier you seek that therapy, that outreach for supportive therapies, the better it's going to be for you in the long run. Because if you can prevent that more complex scenario, that more advanced stage, diagnosis, the better you're going to be for it. And it's often quite simple. You just have to make the commitment and be motivated to make the changes that are required and recommended for you.